You can
How
see
are
me
you?
okay? My
I can
center
see you.
there.
Yeah. How's your day?
Oh,
Okay, I'll get started then. So, I put a video up in the morning, asked people to ask questions, and
uh-huh.
95% of the 30 questions today, or 35 questions, were about the 18 plus vaccination clinics pop-ups that will be coming in hotspots. I know that there's two at mosques right now, correct? Me if I'm wrong, is that correct?
Well,
Uh,
3-1 in Brampton.
okay. So when is it coming to the rest of the hotspots, the 18 plus vaccination pop-ups?
So these are all good questions, and I've been fielding those inquiries myself through the office because the province directed us to have pop-up clinics for 18 plus. And I know Dr. Lowe feels strongly that this diverts away from the mass vaccination centers because he can vaccinate 15,000 people a day if we have the bookings and we have the vaccine at the mass vaccination sites. We just need the ability, and I'll be asking for this at my press conference, which has to be Thursday morning, not Wednesday night, because we have a conflict. I'm trying to remember what it is, but there is one. And so we were asking for the ability for him to lower the age category, because right now the province controls on their COVAX system
Yeah.
the age determination, and right now it's still 60 plus, except it's 55 plus in a hotspot zone. If you live in a hotspot zone, unless you're a teacher or special ed, then you're also can come to the mass vaccination center, and it's 45 plus if you want AstraZeneca in a pharmacy or from a primary care provider. So there is lots of criteria. Oh no,
So
presser. Oh, wait a second. I'm just trying to just. No, it is tomorrow.
what's
Next
going
week.
on?
No, just try to confirm that the press conference is tomorrow. Sorry about that. That was
No worries.
Thursday morning. Sorry about that.
It's all
That
good.
must be the following week.
Yeah.
uh,
So 18 plus though.
so there were two pop-up clinics. So, well, three, right? Because BAPS opened initially in the Mundir up on
Yeah.
427, the big white one. And that was and that was a special allotment of vaccine from the province. And it was half of it was to serve the congregants because it's deemed that they are a vulnerable community and a diverse community, which is difficult to reach. Uh, many of them won't go to a mass vaccination center for vaccines. They have more trust and confidence in going to their own community run facility. Okay. And so that model has been applied. You've seen it in Toronto. They operated in hot zones, but they
Yeah.
also operated in places that are cultural as well, or religious nature as well, to serve those vulnerable communities. So that was the first one that was announced, and it was to serve not only, it's actually based in Etobicoke, as we both know, but it was also to serve Southern Brampton and Malton. Malton will be getting their own clinics, all right? And we've just gone through, these were announced to us last night, but they haven't been publicly announced, and I've just been asked to wait till the details are finalized. But there will be clinics in Malton that will serve Malton, which is great because they haven't, because of course, as we all saw today, once you open up a pop-up clinic, all the appointments are gone in 2 hours, and you can't even register, you can't even log on because it's so busy. And I know, because that's what people have been telling me all afternoon. So the earliest two that were announced were MAC, Muslim Association of Canada, and the other one at Neighborhood Nexus. So those were the two that were announced. As well, at the same time, 3 employer clinics were announced: Amazon, Maple Leaf Farms, and Maple Lodge. So those had been announced, and there are quite a number that are pending and that will make everyone happy, but I just don't have the ability to announce them right now. All the details are being finalized, but there will be many more. Those are just the first of many, and they are to serve vulnerable communities in their own settings.
So there'll be many more in the coming weeks, I'm assuming.
There will be in the coming weeks, yes. Next week there'll be more announced, and in May, because we get more vaccine in May, right? We're in a bit of a drought right now, right? Now, I have to be honest, these are provincially mandated, so don't get mad at me, because Dr. Lowe's preference is that everyone go to the mass vaccination centers because they're the most efficient way. And for any of us who have gone through them, you can, and I think you have as well, right? Did you go to a mass vaccination?
I went to a pharmacy.
Oh, you went to a pharmacy. Well, of course, you don't hit the age category. Some of us do. But they're very well run and very efficient, and you're in and out in less than 30 minutes. So they're very well run. And everybody who has gone through has praised them. So they are the most efficient way of doing things. But the province, and you've seen the city of Toronto, diverted vaccine to these pop-up centers, whether they are in just hotspot postal codes or they are in cultural settings, shall we call them, to serve marginalized communities.
One of the questions that we get asked, obviously, so with these 18 plus vaccination clinics at mosques and religious community centers, anybody can go, right? They don't have to be Muslim or anything like that. Right?
That is absolutely correct. Everybody can go. Everybody can go that can get an appointment, but we both know how difficult it is to get an appointment, because I know of people who were refreshing all afternoon and then didn't get one. I will say that I know for a fact that with the BAPS, with the Mandir, a certain percentage is given to the congregation because that's the purpose of it, to serve that community, because it's a vulnerable community. So it wouldn't surprise me if that weren't the case.
So let me ask that. This morning they announced 45 plus at the mass vaccination clinics.
No, only if you live in a hotspot zone. Zone. Yeah. So for the mass population, oh my gosh, this is what I'm going to cover in my press conference.
Confusion. You don't. I can't.
How to run a vaccine rollout.
Yeah.
101. All right. So for the general population, it's still 60 plus.
Oh, really?
Yes, for the general public,
well,
60 plus. It's 45 plus now if you live in a hot zone. Now, most of Peel is in a hot zone, except for 3 postal codes in Mississauga and 1 in Khaled. So we're going to be asking the Premier to allocate all of Peel as hot spots, because of course this virus travels. It's across the street, right? It's literally across the street, those 3 postal codes. So that's what we're going to be asking. So if you're 45 plus and live in a hotspot, you can go to the mass vaccination center. Or if you're a teacher, and there have been pop-up clinics for teachers as well, but they can go to the mass vaccination site if they live or work in a hot zone. Unless you're special ed teacher, then you can go to the mass vaccination site. And if you're 45 plus, you can go for AstraZeneca in a pharmacy or from your primary care provider. And if you get lucky and you live in a hotspot, anyone who is eligible to register 18 plus in the pop-up mobile clinic, if you can register, because those are really tough appointment to get.
I think your presser on the TV should be an hour long, and you should just literally
go through all of these.
Yeah, and have pictures and PowerPoint and everything. And
you and I, we study this. We're insiders, and it's confusing. So I can only imagine how confusing it is for the public. So
I get about 60 or 70 texts a day. I can't imagine how many texts you get.
At least that, just to my personal phone. And then there's my work phone, and then there's the office, right? It's just endless, and people don't understand.
I just say, talk to Bonnie. That's what I say.
I said, no, catch me on Khaled's show and in Saga.
Let's get off the vaccine tip here.
And what we also want is to allow Dr. Lowe to have the authority, the power to be able to drop down an age category when he sees that there are appointments that aren't being filled. Because we were criticized today that someone called and said, I saw lots of available appointments. Let us drop down an age category. We don't have the ability to do that. Only the province does that. Unless you're on your own system like York is. York has their own system, so they drop down easily.
So I know we talked about this too, but I mean, like, if we break the rules, right, what are they going to do? Give us less vaccine?
No, it's not that. It's that the Peel mass vaccination sites are on the provincial system, which doesn't allow you to book if you're not in that age cohort, that age category, right? So Trillium Health Partners has their own system. So if you want to go to Trillium Hospital or UTM, they have their own system. They potentially could move down an age category, but we try to keep it consistent, right? Because it causes more confusion if we don't. Now, see, the region of York has their own system, just like Trillium Health Partners has their own system, our own system. So they can drop down whenever they're at 35 plus for hotspot zones.
Well,
And I think they're at 50 plus for general public. But they have their own system. They can do it. The COVAX system, which is the provincial run system, is at 60 plus for the general public. And we know all the other variations, I think. If not, I can repeat them.
158 people or 160 people watching right now going, what?
I know. And you and I know the rules, and it's complicated.
So, okay, let's get off the vaccination tip. So let's talk about tickets. Did you guys hand out any tickets? Okay.
Yeah, I printed them. I printed everything I know you're going to ask for.
Okay, thank you.
Yes, and then we want to talk about, remind me to talk about outdoor recreational activities too. Because I was just answering a few questions on a Facebook site that didn't have all the information. Yes, private residents offering music classes, organized basketball games, 4 tickets, 3 of them a reopening of Ontario Obstruction Act. Those are serious tickets. Recreational amenity, 1 ticket. Private residence gathering, 1 ticket. A car meetup. So those, we used to see those up at the in the Heartland area. Those big car meets, 15 tickets. Private residence gathering, 1 ticket. Organized sports, the soccer game, 10 tickets. And another private residence on Sunday. That was Sunday. The other one was Saturday, Friday. And then I have a list of every single park in Mississauga where we did, where we had educate from ambassadors. A whole list of those.
Mayor Crombie,
so this past week there were 34 charges.
Okay. Is that gym still open?
I believe they're operating under a loophole. There is a loophole that allows gyms to open for people with disabilities who need the as sort of physiotherapy, I would think. But they have broken all the rules by allowing anyone who wants to go in. So we're working on it. They know we continue to charge them with improper opening, but they're also continuing not to abide by the rules. So they're looking at ways that they can be closed.
Okay. Let's move on to the variants of concern. That double variant from India, are there any cases in Mississauga?
So I just printed up the epidemiology report, and I don't have them listed here. It's called P1617, I think.
Yes,
so
17.
617. It's not listed here. So, but I know there are 36 cases, and of course we have a large Indian community, but it is not listed in today's epidemiology report, which I got an hour ago. They give it to me earlier now because they know I need it. So, but the numbers are through the roof. Peel's, remember 8 weeks ago when we were at 60 cases? And then this is when they said, no, it's these variants of concern. They're taking hold and the growth will be exponential. Oh boy. Peel's 363 cases per 100,000. Mississauga contributes 283 to that average. Khaled is higher still at 321. And Brampton's 490. 490 what's 489.5, so I'm rounding. But the positivity rates are all at 1 except for Khaled, and it's just slightly under 1. And then the positivity rates, as you know, Brampton's is 22.2, and that's been all over the news. Ours is 14.7, so Khaled's 14.2. It's still not good. Still not good at all. So we have the majority, the B117 is the major one in here in Peel. More cases in Brampton than in Mississauga. That's the one that originated in the UK. P351 is the UK. There are 10 cases in Brampton, 16 in Mississauga, still holding. And P1, that is the Brazilian. That's holding till it's doubled, but it's still manageable. 44 in Brampton, 3 in Caledon, 22 in Mississauga.
Wow.
And then if you want to hear about hospitals, I did print them. The capacity at Trillium is 96%. It's improved a little bit, but only because they continue to transfer out patients regularly. They transferred out 45 patients this weekend. And they are not close by, these hospitals. They are somewhere in Southern Ontario or Eastern Ontario. So you may be treated, or your loved one may be treated for COVID, but far, far away from home. So that's been tough, but that's the only way they're keeping the hospital afloat right now. They have 126 COVID positive patients, and those are lower now because of the transfers, 25 in critical care. They have vaccinated over 155,000 people, so that's great to see. But the number, they have equally the same number of COVID-related illnesses, which means that these people have recovered from the COVID virus, but now have lingering symptoms of other problems that are related, but not COVID. William Osler's the same, 252 COVID patients between the two hospitals. The Brampton Civic is 183, and I think 19 people in the ICU. They've transferred out almost 200 patients.
Wow.
12 in the last couple of days, 12 and 60 over the weekend, and that's what's keeping them afloat. And when you think about the issues there, it's the stress and the burnout of the doctors and the nurses who have been dealing with this for over a year. And of course, they are just all heartbroken because they're treating the mother of Emily Viegas, who passed away tragically on Thursday. So particularly at William Osler, but of course we feel it here in Mississauga, at Trillium, and all the hospitals, that now we have a 13-year-old that has passed away from COVID. And as we've been saying, it's affecting people, younger people, and the symptoms, they expedite, and they're more severe. So here, she thought she could have a rest, take some Tylenol, and then go to the hospital. And when he checked her the second time, no vital signs.
Wow.
So it's just a tragic loss. And it speaks to how the variants have taken hold and how they are affecting much younger people and much more severely, very quickly. You could feel, oh, I think I can manage. And then a few hours later, no vitals.
Wow.
It's very, very tragic. I mean, I'm heartbroken thinking about this. And now the father's, his wife who's still intubated at the hospital, another child at home as a young son, and has lost their daughter. I mean, how tragic. How tragic. The youngest person in Ontario.
Wow. Well, let's talk about the variants of concern. Obviously, they came through the airports, and I know you've talked a lot about this on TV in regards to closing down the airports, lack of a better word, for non-essential travel. Can this be done?
Well, yes, it can be. First of all, I want to say that we can't close the airport. I think we all realize we cannot close the airport. There are still people for trade reasons or essential travel, must travel. For instance, we have doctors coming in to assist. We have the group from Newfoundland coming to help us, right? We have the Red Cross coming in. These are people who will go through the airports. We need these people to travel. They are essential. Yep. We have goods and products coming in, supply chain issues, right? We have produce coming in. And most importantly, we have vaccine being transported to us through cargo. So to close the airport, no. But to close it to intraprovincial and interprovincial and foreign travel, absolutely. People should not be considering traveling right now abroad or into another province, especially through the airport. But as we know, I believe there are still border checks with people crossing into other provinces. And of course, essential workers will be able to cross over, but not non-essential. Nobody should be planning any personal travel or leisure travel at this time. The borders are closed for that. And you will be seriously questioned for your purposes of travel. And let's be honest, there are people who will go for compassionate reasons as well. But even then, there are many jurisdictions that have the same rules we do, 10 people only. So, perhaps you could put off, the celebration of life until this pandemic is over with. So to close the airport, no, but can we close it to personal and leisure travel? Absolutely, absolutely should be closed. Let's also remember that Canadians who are abroad, for whatever their reasons, have the right to come home, to return home, right? Now, we can make it difficult for them, like we just did for residents, our residents in India and Pakistan. They will have to take an indirect flight, right? There are no direct flights.
No, I can
There
hear
we are.
it.
Okay.
Yeah.
You were, you know how we got the cycling.
Okay.
They have to reroute, and they also have to have to be tested at their point of departure. So, for instance, if they transfer in Frankfurt in Germany or London Heathrow, whatever it is, they probably have to spend at least an overnight there to get a test, another negative test to come back. And Canadian citizens will have the right to come back, and they'll get tested again when they land, and they'll get sent to the quarantine hotel, correct, for 3 nights. So it's complicated, but it you know, it is possible, but we're making it as difficult as possible.
Let's change gears a little bit. Have you talked to the province in regards to opening up outdoor restrictions, golf, tennis, basketball? Any movement there?
So I was just addressing someone on Facebook who blamed me for taking down tennis nets.
It is all your fault.
Come on, folks. You know I'm in support of outdoor recreational activity. I'm the one who loves to go on hikes and, you know, and be outdoors and run outside and work out outside. So you know, I'm with the science table that has encouraged the opening of outdoor recreational amenities. We know the risk of transmission is very low when we're outside, very, very low, almost minuscule. And if you're near someone who's not part of your household or just passing someone on a trail, please be sure to wear your mask. But you know that the only place I have some concerns are the basketball hoops, because I do know that they tend to gather, the kids tend to gather, and we can't allow that. I mean, for families, brothers, want to shoot baskets with each other, perfect. People outside playing tennis, you know, you're on other sides of the court, folks. There's nothing wrong with that. Even golf, I can make an argument for that. Soccer, kicking a ball, baseball, etc. Working out in outdoor equipment. I don't have an issue with this because I know transmission is low, and I know people need physical activity. They need it for their physical health and their mental health. We need to get outside, particularly now the weather is getting nicer. So this wasn't me. I've been strongly saying I agree with the science table that it's safe and we should be encouraging people to get outside and get some exercise. So, but if they tell us we have to take down the nets and the hoops, unfortunately, we're the ones who implement their decisions, right? And enforce the decisions. And it breaks my heart. So I'm actually very hopeful that when we see things starting to plateau, that they'll say, okay, we feel now we can reopen outdoor activities. And I think that will be the first thing that will open.
So kids can only play 21 on the basketball court. I'm kidding. So,
right.
Do you know what that is?
21? Yes, of course. 21.
Okay.
Yeah, who gets to 21 first? Yes.
Change gears again. Is there any action in regards to cannabis retail in Mississauga?
So we haven't got. Yeah, you ask me that every week. We haven't got there yet. How about I will tell you when I know it's coming up the following week, but it's not there yet. It's not there yet. We just actually, it's a good question because we did look at cannabis in illegal dispensaries at Police Board, and that was in the open session, in the public session, and that report will be sent to Regional Council. But I think Brampton for sure. Did Khaled in retailing as well, or just Brampton? Brampton does. It's only Mississauga that opted out, I think. And so one of the dispensaries that had been identified, illegal dispensaries that continues to operate, is in Mississauga. And what they showed is that these illegal dispensaries come with a lot of other illegal activity. Yeah. Plus the fines aren't nearly sufficient to close them down because of the amount of money they actually make. So, you know, we can make an argument here that they should be open just so we can have better control. But you know that my councillors have an issue with zoning. They want to be able to have input into where they will be located and the number that will open, the concentration of them in one area. And of course, we don't want them by schools or community centers or drop-in centers or congregate settings or daycares, etc. And we want to be sure that all those open, those for lease signs won't be housing only cannabis stores. You know, it's okay to have one or two in, you know, Streetsville, Port Credit, Clarkson,
So,
etc., but not everyone.
Mayor Crombie, so you said you guys are going to talk about it in a couple of weeks. Is that correct?
Well, I don't have the date yet, but the report I'm told will come back before the summer recess. And if not, it'll be first thing in the fall. But it is scheduled to be brought forward, yes.
And then that's when you guys vote? Is that?
Well,
yeah?
well, hopefully.
Oh, okay.
Hopefully. So, you know, there could be some counselor that will say, I want to defer this back for more study or something, but hopefully we'll bring it back. That does happen, right?
Yeah, true. Okay. I went to TL Kennedy and there was a beer store and liquor store directly beside the school. I think I did. Yeah. So
when I was in high school, the age for consumption of alcohol had gone down to 18.
Oh,
I was in that brief little window of people who were actually in high school and could consume an alcoholic beverage to go for beer at lunch.
That's pretty crazy, actually.
Yep.
So,
I tell you the year, but then I give away my age, in case everyone doesn't know it.
I'm just going to Wikipedia your name. So, okay, let's talk about, so Toronto's talking about talking about drinking in parks, right? Is Mississauga?
I thought that the province had allowed that already.
Well, I think Toronto said they weren't in on it yet, but so is that something that Mississauga is looking into, or are you saying that we can already do that?
I was under the impression that we could. So
okay.
if we can't, it was something we'll look at. And I'm just getting a note because, you know, I always have to look down and see what they're telling me. And they're saying, no, you were correct the first time. Your presser is Thursday at 9 a.m. Trying to remember why that is.
Okay. And then,
I know why it is. It's because we not only have a general committee meeting, but then we have budget committee. And budget committee will take us probably till 5 o'clock, if not later. We're having the first look at our 2021 budget tomorrow. And so the press conference got moved to Thursday morning at 9 a.m.
Okay, let's end with a positive note. They're expecting 1 million doses every week until June. That means everybody in Ontario can be vaccinated by June, at least the first shot. So
wouldn't that be fantastic? Yeah, I think the numbers are 40% by the end of April and 60% by the end of May, and what you're saying, 100% by the end of June. Wouldn't that be fantastic? But before we leave, because my staff always watch this program, I want to say happy birthday to Michelle Baker, who is my acting chief of staff and who's fantastic. And I know her kids have a big night planned for her, and maybe they're taking a hike around Crawford Lake because they saw my pictures and they were odd. And so I just want to wish Michelle a very happy birthday today.
Awesome. Okay, we'll end on that note because it's positive. All right. Okay.
Thank you. But or the vaccines, everybody, that would be fantastic too. Thank you.
Mayor Crombie, thank you so much. I'll see you next week.